Hi, welcome to Candid Chats on Cancer. I'm Mary Robinson.
I'm Jamie Moore. Mary, who are we chatting with today?
Well, I'm super excited that Dr. Stephanie Koroleski is here today. She is the co-founder from A Time to Heal Foundation, and I was fortunate enough to actually take your course, 12-week program actually, and brain fog class. I don't even know, the list goes on and on with what this lady does. So we're super excited to have you here.
Thank you for having me.
Thank you for being here. So you're a psychologist?
I am.
Yes. Can you tell us a little bit about your role?
I got my degree in psychology thinking I was going to do completely something else, but then when I went to do my internship for my PhD, I ended up working in a cancer center sort of by accident. And I found out that everything that I had ever learned in psychology applied to the people in the cancer setting.
Yep.
So everything about trauma, everything about grief and loss, everything about marriage and family, everything about dealing with anxiety, depression, all of that. And I loved it. When I finished doing my internship, they offered me a job and I just stayed for the next couple of decades. So that's kind of my role, is support, encouragement, teaching skills for people to cope when they're going through all of the treatments and afterwards, and helping their families as well.
Oh, yeah. Well, I know that their program is excellent, and I keep telling Jamie about it, like him and his wife should go.
Yes.
Yeah.
As soon as we find the time, but, oh, wait a minute, that's not even this program. So A Time to Heal, how did you come up with this idea?
Well, my friend Kay Ryan and I both worked in the same health system. And Kay had had some experience as a cardiac rehab nurse, and I was really in the cancer center, but I was also a consultant to our cardiac rehab. And then Kay got cancer, and she said, "Where's the rehab?" And I said, "Well, that's the problem. There isn't a rehab. There's nothing to help you get well again. So you guys know, you're done with cancer, and they say, go have a good life.
Right.
And you're scared and you're tired. You probably never felt weaker in your life." And we thought there just has to be something better. And doing things one-on-one, or even for a patient to have to see a dietitian and an exercise consultant and a counselor and 15 other things, there's not time for it.
Right.
So we thought we could find something on one of the coasts. Surely somebody else had done this and brought it in. And we spent about a year researching all over the country and couldn't find anything that was holistic. And so we thought, well, there's a lot of smart people around here. So we invited a big multidisciplinary team, and we said, if you were going to design exactly what you would want cancer patients to know about how to get well again, what would you put in the program? And so everybody contributed, and that's how we came up with that idea. And we thought one of the really important components of that is to have patients be able to talk to other patients, caregivers be able to talk to other caregivers, because people want to hear from each other about what their experiences were like. So
That's how we started this show, because we wanted to help people. And like Mary's very active in the community. With my cancer, I kind of holed up in my house. And I didn't even know about your program, and she just went on and on about it. And we've actually talked to other people who've gone in the program, worked in the program. You're right, for cancer patients, I'm an RN also, and an intensive care nurse on top of it all. So I knew what was going to happen, but you had all these beautiful support system while you're sick. And then when you get healthy, it's just like you said, the doctor goes, well, you're healthy, we'll see you in
3 months.
3 months. And now what do you do?
yeah, that's why we decided to focus on that survivorship piece, because when your treatment is finished, your support system generally dries up.
Yeah.
You're done with your crisis, you're fine now, get back to normal, only you don't feel normal. And there's so much more healing to be done, and you're worried and you're nervous and you're weak, you haven't gotten your strength back yet in many ways.
Yeah.
And a lot of people are in ongoing treatment. If they've got more of a chronic cancer, they're never really done.
Yeah.
And even if you are done, it's not done here. You still think about it.
It's hard. Every
hard.
lab test you have, every CAT scan you have, it's very difficult for survivors. We're always thinking about it. But your program teaches people how to deal with the anxiety and the depression and the scariness of cancer, if I'm correct.
We do. That's part of our focus. We have a lot of different things that we focus on, but that's a big part that's interwoven throughout all of it. Because truthfully, you know, once you've been through cancer treatment, it's never the end. You know, you always have checkups, you always have tests. Even if you've been cancer-free for 10 years, you still go back for those tests. And you can't not be nervous about that. If you are really amazingly stoic, but I don't know too many people that don't worry about that.
No, you constantly worry about it. In
Yeah.
fact, Mary and I had a discussion a couple of weeks ago about my lab test that came back. Yeah, it's very scary. But so, how do you help survivors? How do you help us get from that scary point of where our help just dries up and everybody tries to get on with their lives?
And maybe the fear factor.
Yeah.
Yeah, you know, I think it really starts very internally. It's sort of cosmic in a way. You know, you have to think about who are you and what are you here for, and why are you unique? You know, what are your unique resilience factors? Because for adults who have cancer, this isn't the first time you've been through a hard thing in your life. First time you've been through something like this. But how have you gotten through things before? What are your strengths? And then what's your intention? What do you really want to do at this point in your life? Because most of us are pulled in a million different directions, but when you're really ill and your life is threatened, you need to really put yourself at the top of your intention. And so you aren't necessarily going to be able to respond to every demand from every other person, and you need to be really clear about what your priorities are. So we start there with, you know, there's a lot right with you. You know, you've been just spending all these months focusing on what's wrong with you and everything, but there's a lot right with you. And there's a lot right with you, especially in your strength and your values and your core belief system and what's important to you. So we always think start from that point because it's different for everybody. And people, once they are really clear about what they want out of life, you know, and what's important to them, then they can begin working toward it. And you begin to make some decisions about, you know, I choose to put my time here, but I choose not to put my time there. You know, if my health is threatened, I need to make time for the things that are healthy for me. And maybe it's exercise, or maybe it's eating better, or maybe it's being with positive people, or maybe it's your spirituality. We talk about all of those kind of things too. And then we deal with the fact that you can't be Pollyanna all the time. In all the research, they always say have a positive attitude. But if you really read the research, they didn't mean run around and say, I'm fine, I'm happy all the time. That's not what a positive attitude was. In the research, what a positive attitude was somebody who really understood what was going on with them and they were real with their feelings. So if you're having a good day, that's great. If you're angry, you're angry. If you're sad that day, you're sad that day, and you let all the emotions go through, because it takes a lot of energy to stuff your emotions down. And so you got to have safe people, you know, to talk to about that kind of stuff, and whether it's your group like at A Time to Heal, or whether it's your family and friends or whoever, you've got to be able to let some of that stuff out in a safe way. And then you have to start really thinking about, how do I cope with those demons that come up in the middle of the night? Everybody else is asleep and I'm wide awake thinking about all the horrible things. So we teach a lot of different skills, and a lot of them are aimed at staying in the present moment, and aimed at mindfulness, aimed at using your power of imagination for good things. You know, worry is really just imagining the worst, you know, in an unknown situation. I mean, it's like, you know, you're always thinking about the bad thing that can happen, how, you know, if I will be in pain, or, you know, if something else bad will happen to me, or whatever, to my family, or whatever. And it's always out here in the future. So if you can stay in the present moment, whether it's through a mindfulness technique or a meditative technique, or maybe it's just doing something that really feels good, like get up and, rather than lay there and toss and turn and be miserable, go take a nice warm bath and, you know, and just really feel good in the water, or take a shower, feel good. Go have a snack and have it be something that you really enjoy, and just savor it. You know, it's something different, because you've got to, I almost think you need to get out of your head and into your body. You know, to change that. But there are a lot of different ways to do that, and we try to give a lot of examples, and then elicit those examples from other people in the group, like when you are able to get out of that, how did you do it? What works? Let's make lists, let's write down and try these different techniques. And that's like, you know, all the power tools that we do,
Oh,
that
yeah.
we say power tools every night, something that you can do in 5 minutes that'll be helpful to you. And it's not enough to give somebody a sheet of information that says, here's, try these relaxation techniques.
Right.
If you don't practice them, you don't know them. And so you have to practice some of that and see if it works for you.
Exactly. Even like the affirmations, I really like to listen to music. Sometimes I even turn on a meditative CD at
Oh,
night.
yeah.
If I get up and I can't sleep, I just, you know, push the button and it plays and I'm asleep before I know it. Those are some of the things that I like to do.
Yeah.
But your program really helped with that.
Well, and I think part of it is everything's different. We always say in our program that, you know, you really need to start building yourself like a smorgasbord, because not everything works at every time.
Right.
So anytime that somebody gives you an idea of something that could work, just write it down or put it someplace, try it out. Maybe you like it, maybe you don't. It's like, you know, if you go to a buffet and you kind of sample everything,
Yeah.
and then you try to save enough room to go back for the really good thing and have more of that, you know. And that's kind of what you want to do with all of these techniques, because some people just really hate those meditative tapes, and other people, they work like a dream. Some other people do better to get up and walk, you know, or get on their treadmill for a
Right.
while. Some people do better to watch a game on TV and really get into watching the baseball or basketball or whatever the season is, you know, and they can really get into that. It's a different form of meditation. Meditation is just really focusing your mind on one thing and not letting it run all over the place. And when you're really focused on one thing, you're not worrying.
Now, is that what you mean by mindfulness?
Staying in the moment, like putting your mind on one thing and staying there.
Okay.
And so, like, a lot of people do that. Anything that you can really concentrate on. So sometimes you do that at work, like you're just really busy in your work. Some people do it through crafts, you know, because you really have to be pretty detailed about what you're doing. You don't want to mess up. Some people do it by reading a great novel, you know, and they're just so into that novel, you're not worrying because you're into that novel right now. You see athletes do it a lot of times. You know, they're really practicing and they're being so focused on trying to shoot the basket or whatever it is. And you can tell, like when you watch people play basketball, if they're really in the flow and their mind is there, you know, they've done this a million times and they are really there. But when you got all the screaming and yelling from the crowd and the nerves and everything, a lot of times it's not. And they're practicing that all the time so that some of those great guys can go out there and just sink it every time, you know.
Yeah.
It's amazing.
It is.
But, yeah.
But there, for anxiety, what do you recommend for anxiety? Because I know a lot of us with, you know, with cancer diagnosis are anxious from the minute we get it until the minute we don't have it anymore. Is there any good hints in your program for people with anxiety?
Right. I always say, you know how like when you're in the hospital, they always say, what's your pain level on a scale from 1 to 10?
Yeah.
You know,
Sad
where's your
face
pain?
or happy face?
Yeah, yeah, sad face to happy face or whatever it is. But you know, where is it in there? If you think of anxiety that way, from like a 0 to a 5 or 6, a lot of things that you can do for yourself will help you. Once it goes beyond that, I recommend taking your Ativan or whatever your doctor gave you, because really it will work faster. But like on the early levels of anxiety, if you catch it, watch what's making you anxious. And so it might be like, what's that thought that's running through the back of your head? Are you dwelling on it or not? If you can, you get out of that thought and into something else. You know, and that's where this mindfulness thing would come in, or staying in the present moment, doing something that takes all of your attention. So you've got to put your mind in a calmer place, if you can. Sometimes that doesn't work. You can do something different with your body. Breathing, and a lot of the meditation techniques use breathing. And so one of the ones that we teach early on is just that early breath counting. And basically you're just breathing normally, but on the exhale, you say the number 1, breathe again, number 2, and again 3, and 4, and go back to 1, and just pay attention to how the air feels coming in, going out, and the number. So your mind is totally on keeping track of the number and paying attention to the airflow. And it takes some practice. But when you do that, we've had people tell us that out of the whole program, learning to do that was the thing that helped them most. They say, I haven't slept for 4 years and now I can fall asleep at night. And, but there are a lot of different kinds of techniques. In a lot of the churches, they teach centering prayer, and centering prayer is very much like that, where you're breathing and on the exhale, you're saying a holy word, or maybe the name that you say when you address prayer. So it might be something like shalom, or it might be Jesus, or it might be holy, or whatever, and you just stay with that. And you say that until your mind is completely calm, and then you just imagine yourself sitting there in a good place, maybe with God. You know, one of the men I worked with one time, I was amazed, and he was also a stage 4 colon cancer survivor. And he said, I never have trouble sleeping, though. He said, you know, other things bother me, but I never have trouble sleeping. And I said, well, how do you manage that? And he said, I just imagine I'm laying down in the arms of my guardian angel, and she wraps her wings over me, and I just lay back and nothing bad can happen to me there. He said, every night I do that. And so anything with imagination can work, putting yourself in a safe spot. That's why some of those CDs work so well too, because they create a beautiful place for you where you really relax, and then your body can just fall asleep. Different things work at different times. Self-hypnosis can work, you know, learning those kind of techniques. So I usually advise people, you know, we teach a lot of those techniques in the class, or maybe have a session or two with a counselor who can really work with you on something that works with you.
One level?
Mm-hmm. Yeah, because, you know, it's just different for everybody.
Right.
You know, some people just get even more anxious if they have to be really quiet, and other people need to get up and do something physical. And it's different things work at different times. But that's why you really want to stuff your backpack with a million different tools that you can use at different times, because you know, sitting in a doctor's office waiting for a test is different from being awake at 2 o'clock in the morning when everybody's asleep. And, you know, so it's just having different tools. And the more you have, the better off you are.
Mine was always eating, because I lost a lot of weight. So every time I would get caught in the what ifs or in that anxious moment at night, I would get up and make myself a snack.
Yeah.
Well, hey, that works.
Yeah.
Worked for me, but a lot of times, like you're saying, though, that didn't work. You know, so you got to have 4 or 5 or 6 or a dozen techniques to get you in there.
Yeah.
That's mindfulness is a great idea.
Yeah, it's kind of like if you're stuck in your head, then get into your body. If it's your body, like some people just get that body tension, they're like, I don't even think I'm thinking about anything. Well, something's stuck back there, but still, but then maybe you need to do something different. Maybe a mind, like a relaxation tape or something would help then. For some people, it's like they just need to be with another person. It's like you go to your husband or your wife or your friend and say, you know, talk to me for a while, or you go pick up your dog and you just pet your dog or your cat, and you just need contact with another another living thing. You know, you need somebody to love you or hold you or pet you, you know.
That makes a lot of sense.
Yeah.
It does.
There were so many times that I couldn't move, you know, off the couch for more than 2 seconds, and my animals, my dogs, were sitting right next to me, and it was just wonderful, because I think they just knew they needed to be there.
They do, and I don't know, a lot of people believe that they have good energy that they impart to you as well, and I know so many people have said, my dog pulled me through my cancer treatment, or my cat, you know, and you know, my cat laid here and purred on my chest, and that's what healed me, and I'm like, I'm sure of it, you know, I'm sure that's a big piece of it, because that feelings of being loved are really important, and I think that's one of the things that happens with cancer is, you know, cancer is such a threat to everything.
Right.
And it's a threat to your life, it's a threat to your relationships, to your work, to your sense of yourself, your body, you don't even know. And one of the big things for adults is like, you know, if I can't be this human doing that I've always been, and if I can't do everything I've always done, is anybody still going to love me? You know?
Yeah.
Am I too ugly? Am I too weak? Am I too deformed? Am I too useless? And those are all those things that go through your head that are part of the fear and part of that self-doubt. And so when you can connect with other people, people who love you, and one of the things I love about working with cancer groups is, you know, at the beginning of the group, everybody comes in, and a lot of people still don't have their hair, or they just feel bad yet, or they've put on their 30 pounds from tamoxifen and just don't like the way they look, or, you know, whatever. I mean, people just are, or they've lost a ton of weight because of their treatment, and they feel very self-conscious, but they're all in the same boat. And about halfway through, they start realizing they really like this other person. This person's got a great sense of humor, they're really fun, and you don't see them that way. And then you can almost see the light bulbs go on in people's heads, and they're like, oh my gosh, I guess I'm likable too. They like me too. And I'm not who I used to be, or I don't have my hair either, or whatever. And all of a sudden you get that sense in yourself that there's more to me than how I look or what I do, that I'm still a valuable person. And that's a huge thing to regain. So.
Because I do actually, I do feel like I'm not the same person I was, but I've had cancer twice. I don't know if that makes a difference or not, but I'm just like, I just feel different. I'm okay with it, but I do know that I'm not, I don't have the same stamina, not even the same likes in some ways.
Right.
And I'm okay with that.
It's a huge experience though. I mean, like, whatever other major life experience have you ever had that didn't change you?
I know.
You know, every big life experience, whether it's going to kindergarten, it changes you, you know.
Yeah.
Going to college, it changes you. Getting married, having your first child, you know, working at a real job, you know, when you get out of your high school jobs and you're working, all of a sudden you have to be there all day long, every day. Joining your life with somebody else so that you're responsible for somebody. I mean, all of those things change you. You can't go through any big learning experience and have it not change you. And the question is it changing you for the better in many ways, too?
And will everybody still love me? That's,
Yes.
I guess, my thing when I was going through that. It's like, I feel like I'm a different person. I hope everybody still loves me.
Yeah.
And they do.
Yeah.
You know.
Yeah, and a lot of it is, you know, do I still like the same things, or have I changed? Have my priorities changed? Because if the most important thing to you before was always having the latest fashion styles or something like that,
Well, mine was cleaning the house.
you really like
I
cleaning
like to
the
have
house.
a clean house. And I'm like,
Yeah.
that's like, but
Yeah.
so, not that I let it go. I just want everybody to know that. But you know what I'm saying.
Right, but your priorities change.
Yeah.
Yeah.
You know, and where you want to spend your time changes. And so a lot of times maybe you would rather spend your time with your family and having real conversation with somebody than, you know, scrubbing the grout in the kitchen floor, you know. I mean, it's like things change, and that's okay. And the people who love you change too. And some friendships might not exactly be lost, but kind of become less. And sometimes they're lost, I guess. And then other new people come into your life. Like,
Yep.
how long have you guys known each other?
We're about 12 years now?
Yeah, 11,
So
12
you,
years.
You knew each other for a long time.
Yeah.
Yeah. But you know, like when you go through treatment stuff, very frequently you make new friends, you know, your chemo buddies and your nurses and your doctors and support staff and people that you knew, and they become very close to you because
Yeah.
they really understand what you're going through.
Yeah.
So I don't know, life is always evolving and changing. And that's the same thing people feel as they get older. It's like, I can't do everything I've done you know, and it's like, you know, will my family still come around and see me? You know, now
Yeah.
that I'm not having 45 people for Thanksgiving dinner or whatever.
Exactly.
Yeah,
Yeah. It's change of perspective, I
it
think.
really
Yeah.
is.
It really is.
And putting it in that perspective, it does make sense, you know, going the first day of school and the first day of college, the first day you walked into an intensive care unit, and
Oh, yeah.
I never even thought about it that way, that you know, because when we hear cancer, it's kind of like, it seems
Yeah.
like my mind just shut down,
Yeah.
and you know, you become very lonely in a way.
Yeah.
And try to reach out, but there's that fear. But now that you put it in the way you put it, it does makes perfect sense. It's just another part of our life. It's just how we're growing.
Exactly.
You know, we've been friends for many years, but we didn't get really close until both of us were sick.
Yeah.
You know, and we leaned on each other. Well, I leaned on her a lot, actually.
And I leaned on him too.
So,
Yeah.
but brought us closer together. But then when you get well, you know, she got well, I got well, she went her way and I went mine, and luckily we got back together for a joint, you know, adventure of what we're doing. And without her, I would have never got to meet any your program, you know, what a great program. So now, is it only localized here in Omaha, or is it now national?
We have it in every city across Nebraska where there is a cancer treatment center, plus several others that have like acute care hospitals. We've got 2 sites in South Dakota, we've got 2 sites in
Really?
Iowa, we've got one up in Wisconsin. And we've trained people in other areas of the country. Sometimes they don't keep them going as long, but there are people that we know how to do the work. And so, you know, if you knew somebody out there, we might be able to refer you. But, you know, my goal when I started was to do Omaha. And then my next goal was, let's do Nebraska. Because especially in the rural areas, you know, it's like people don't get that much support. And they're not going to be able to drive back to Omaha, you know, for 12 weeks after they're already done with treatment. So can we take this to someplace closer to home? And now it's kind of like, well, we're that far, and then other people want to do it too. So we wrote a trainer's curriculum and everything, and so we've got trainings that we do for people if they want to start up a new site.
That's wonderful. And where can people find you? What's the website?
atth.org, like A time to heal, atth.org.
Yeah, that's great.
Yeah.
Doctor, thank you ever so much for coming on our show, and thank you ever so much for creating this program for survivors, because like you said, there's nothing out there for us.
I do have to real quick say though, and also for caregivers, because I know that my husband absolutely loved to go too, because I think sometimes caregivers are left out.
Caregivers are really left out, and especially when they're told that you're cancer-free now, well, they kind of have lost their job.
Yeah. Well, and it goes in and out, doesn't it?
Yes.
That's a topic for a whole nother evening.
I know. Will you come back?
Sure, I would be happy.
that'd
We'd
be
love to have
great.
you come
Love
back.
to have you back.
So,
All
All right, well, thank you so much, and
You're
I hope
welcome.
you'll join us again for another Candid Chats on Cancer.
We'll see you on the next episode. Be well.